Thank you for listening to Depictions Media Radio.
We are in the midst of a global pandemic, a pandemic which has meant that people are very worried. People have been hard hit. We know that families have lost their jobs, families have lost their loved ones. Seniors have been hard hit in long-term care homes. And across this country, millions of Canadians have lost their jobs. They didn't only lose their jobs, they also lost their benefits. And what we realize more than ever, our healthcare is vital to help us get through this pandemic. And in this pandemic, we've seen as people have lost their jobs and their benefits, they've lost some of the vital healthcare that they used to have access to. On top of that, millions of Canadians already didn't have access. I'm talking about dental care. Dental care is vital. When people lost their jobs and their benefits, they weren't able to access the dental care that their families and their loved ones needed. So we have a plan that we are putting forward. I'm really proud of our Member of Parliament, Jack Harris, who's raising this as a private member's bill. Plan to provide dental care to those in need. This will make a massive difference in the lives of families, saving families on average $1,240 a year. This will provide coverage to families earning less than $90,000. This will make a massive difference in people's lives. And we've seen in this pandemic, the more we can invest in each other, the more we can support each other, the better off we are. Donc, on a vu dans ces pandémies que c'est tellement important de prendre soin les uns des autres. Et c'était un temps difficile, c'est un temps difficile parce que on a vu des millions de Canadiens frappés par la COVID-19. Nos aînés dans les centres de soins de longue durée et les familles qui ont perdu les emplois et en même temps ils ont perdu leurs bénéfices. Ça veut dire qu'ils n'ont pas accès aux services de santé qu'ils avaient pas accès dans le passé. En particulier, je parle des soins dentaires. C'est essentiel. Et on a appris pendant cette pandémie plusieurs Canadiens et Canadiennes qui ont perdu leur couverture, leurs bénéfices. Donc, ce qu'on propose aujourd'hui, je suis tellement fier de mon collègue, le député Jack Harris, qui va présenter comme son projet de loi un projet de loi pour donner des soins dentaires pour toutes les familles qui gagnent moins de 90 000 $. Donc, ça va vraiment aider des gens. C'est un soin essentiel. Les soins dentaires, c'est fondamental. Et je suis très fier de continuer la vision que l'NPD a commencé avec Tommy Douglas. On va continuer ça pour donner ce service essentiel aux gens. We started the idea of universal Medicare. And in that vision, it included dental care. So we are proud to be able to present the vision of including that universal healthcare coverage from head to toe. And I'm really honored now to pass the mic over to Jack Harris, who's going to share some thoughts and some personal experiences why this is so important. Jack?
And this is a great day. I'm very excited to be presenting today in the House of Commons. On the order paper will be a plan to ensure that all Canadians have access to dental care. The government calling on the government to establish a federal dental care plan as soon as possible for Canadian families that are earning less than $90,000 per year who aren't covered by a current plan. This would be an interim measure towards the inclusion of full dental care in Canada's healthcare system. As Jagmeet had said, part of the original vision of healthcare in Canada through Medicare of Tommy Douglas, and something that people who know about this are already very excited about it. We know that 1/3, 35% actually, of Canadians have no dental care plan. And we do know as well that in excess of 1 in 5 Canadians forego dental care because of the cost. That's especially just more so true of women. 25% have indicated that they have not gone to access dental care because of cost. And in fact, a higher percentage of young people between 18 and 35 have also indicated that they have not access dental care. I think it's 28% was the Statistics Canada report. This is indicative of who doesn't have access to dental care and who needs it. We have, stories that have been told to people, young people who aged out of a family plan, for example, because they turned 21 or they finished school, people who had never had access to dental care and have suffered as a result through loss of teeth, loss of self-esteem, loss of health, loss of the ability to actually fully participate in social life and the employment world. This is a real, very, very serious problem and issue for Canadians, and this measure will go a very long way to bringing about greater equality in Canada. People tell me, of course, if you break your wrist and you go to the doctor, you go to the hospital, you get cared for and you get looked after. If you lose a tooth or if you have a dental care problem, you have to pay for it yourself. Only 6% of costs of dental care in Canada is paid for through public programs, and that leaves the rest to people who can afford it or who can't, and those who can't don't get the dental care they need, leading to contributing to serious other problems like cardiovascular disease and dementia, even respiratory infections, diabetes complications. There's a whole host of ongoing medical costs or medical associated losses resulting from this, and this is something whose time has come. It's an interim measure. It can be done very quickly by the federal government, and the federal government would administer it unless there's an agreement with the provinces, which should be fairly easily achieved because of the federal government paying the costs. The costs have been fully explained and investigated by the Parliamentary Budget Officer. The cost is, on the average, about $1.5 billion per year over a 5-year period. Obviously, there'd be a bump up at the beginning, all of which is explained in a report that the Parliamentary Budget Office released on October 7th of 2020, detailing the cost, detailing the program, and showing how it can be done. I think it's a marvelous approach. I think there's a lot of excitement about it already. We had it debated earlier this year in the House as an amendment to the government's plan to have a middle-class tax cut, and we offered an opportunity to change that, to remove the tax cut for those earning incomes above $90,000 to help pay for this plan, and that was turned down by the House. This is an opportunity for a debate and for a decision to be made to implement this right away.
Thanks so much, Jack. Really appreciate your words. Really proud of you for bringing this forward. The people of Newfoundland and Labrador appreciate it. People across Canada will appreciate it. And really, just to put it again, really bluntly, there are so many people in our country that cannot access dental care, and the pandemic has made it worse. There were already many people that couldn't access it. The pandemic has made it even harder. We want to provide this much needed access to dental care. If you need dental care in this country, you should be able to access it. And that's what this plan is all about. I'm really proud that we're presenting it, and I look forward to hearing your questions. Donc, je suis tellement fier de ce plan, je suis fier de mon collègue Jack Harris, député, et c'est vraiment, effectivement, un appui que les gens ont besoin. C'était un enjeu, c'était un problème pour les familles avant de la pandémie, mais maintenant, pendant la pandémie, c'est plus que jamais important que les gens ont accès aux soins dentaires. Ça, c'est ce qu'on veut faire. Si quelqu'un a besoin de soins dentaires, ils auront dû avoir accès. Et ça, c'est exactement ce qu'on propose aujourd'hui. Thank you so much.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.